So, first of all, thanks so much for giving me the opportunity to talk today. For those of you that don't know me, Seth Davis. I'm the newest addition to the Facial Plastics and Reconstructive Division here at Stanford. And today I'm going to be talking about the role of the otolaryngologist in gender-affirming surgical care. And this is sort of an adaptation of several different talks that I've given over the past sort of year that I've been here. Kind of a combination that I really had to work to whittle down the slides to fit all of the information in. But what I really wanted was to be able to make this applicable to a broader audience and hopefully really personalize it to what we can be doing here at Stanford, what resources are available for us and the patients that we're taking care of. So no disclosures for this talk. Like I said, this could really be broken down into 3 or 4 different individual grand rounds talks, but we'll just start off sort of laying the groundwork for why we're doing what we do in gender affirming care. I'll give a brief overview of the Stanford LGBTQ+ program here and the growth that's experienced over the past several years. We'll dive a little bit into what I do with gender affirming facial surgery, and then we'll look at some resources of how you can incorporate this type of care into your clinic, whether or not you're providing primary gender-affirming surgical care. So this is just a contact card for me, sort of highlighting some of my areas of clinical expertise. For those of you who haven't had the opportunity to get to know me well, I'm coming from Wisconsin originally, born and raised. I did most of my training there. I went to undergrad at the University of Wisconsin. I did my medical school at the Medical College of Wisconsin in Milwaukee. And then I did residency at Vanderbilt in Nashville, Tennessee, and then my fellowship in Indianapolis, Indiana, where we were one of the few states in the Midwest that had that allowed for gender-affirming care under state and federal-funded insurance companies, and we were really the only institution in the state that provided it. So that's where a lot of my surgical experience came from. So this is just a quick breakdown of the things that I do in my practice. It's really very broad, even though facial plastic and reconstructive surgery may be sort of a smaller niche surgical specialty. I could give this type of talk on a variety of these subjects here, but today we're going to focus on my gender affirmation practice, which is, like I said, just a portion of my practice, but I think a really, really important and a really impactful portion of my practice. So I want to start off, like I said, by laying the groundwork, talking about the data that's out there to support gender-affirming care, and in particular, gender-affirming surgical care, and what we're doing in this space. So you'll see a lot of terminology throughout this slide, and throughout this presentation, I'll do my best to try and define that along the way. LGBTQ+ is sort of the umbrella term for both sexual and gender diverse minority patient populations who are sort of grouped into this broader category of individuals for a variety of reasons. And these are really a substantial and growing proportion of the U.S. population. Currently, about 7.2% of U.S. adults identify as LGBTQ+. And there's a rising prevalence, as you can see here, pretty dramatically with younger generations across the board. When it comes to transgender individuals, there's an estimated 1.6 million individuals in the United States who identify as transgender, again following similar trends of a higher proportion in teenagers, but in total making up greater than 1.5% of the population. California sort of sits squarely here in the center. We do actually have the largest number of transgender individuals in the country on a statewide basis, but with such a large state population, we sort of sit squarely around or just above the average for a percentile of our population across the country. Like I said, young adults are the most likely to be transgender or non-binary. This is really following that similar trend that we saw in the previous slide. And the familiarity with transgender or gender-diverse individuals has really rapidly increased over the past number of years. 1/4 of adults say they have a trans friend. 1 in 5 U.S. adults say they know someone who is non-binary. And really, despite this past few decades of social progress that we've seen in this arena, the LGBTQ+ community continues to really face numerous health disparities. This is from a survey-based report on the National Transgender Discrimination Survey, which sort of breaks down the cumulative discriminatory experiences that these patients have. You can see greater than 60% of these patients have experienced discrimination in one of a number of really impactful categories. And what this really breaks down to from a healthcare perspective is that a large number of these patients are avoiding seeking medical care altogether due to the fear of discriminatory treatment. Here in California, this patient population really reflects the diversity of our patient population at large. And this is sort of underlies the urgency of the fact that there is a really stark, elevated amount of violence against this community. We can see here, breaking down the numbers, that in 2024, 77% of victims of fatal violence were people of color, and 53% of these cases are against Black transgender women. And so that really highlights the fact that this may be one of the most marginalized groups of individuals that we take care of in healthcare. Now, sort of worldwide, I think that there has been a recognition by a majority of individuals that this group of people should be protected from discrimination in employment, housing, access to businesses. I have the United States highlighted here, but we really have a ways to go when it comes to accepting medical interventions for these individuals. And I think in light of a lot of the political atmosphere that has surrounded us recently, this is very much, I think, at the forefront for a lot of people. We really have a lot of work to do to advocate for equality in this space for this marginalized group of individuals. And this is really, it's particularly troublesome because transgender patients who have been denied medical care because of their gender status have a 50% higher rate of attempted suicide compared to those who have not. And so this can really be a life-saving intervention, the care that we provide for these patients. So this is a slide I pulled from another presentation, but this, I think, really breaks down my practice and the support for what I'm doing from a gender-affirming facial surgical perspective. Certainly not the only thing that we do in providing gender-affirming care, but it is an important part of gender-affirming care. We know that gender-affirming facial surgery is safe. We know that it's associated with an increased quality of life among these patients from a variety of different metrics. It has a major impact on a large number of mental health-related metrics, and it has been shown to be on par with the other gender-affirming surgical procedures that we do, namely genital surgery, or what colloquially is called bottom surgery or top surgery, which have traditionally been thought of as the more sort of definitive gender-affirming procedures. And this is important because one of the criticisms that's been raised against gender-affirming facial surgery is that this is purely cosmetic in its outcome, and that has clearly been demonstrated by a preponderance of evidence that that's not the case. We know that it plays a significant role in changing public perception of gender, so how you're viewed by the people that you interact with in society. And so to that effect, can really serve as a protective factor against those disparities for trans individuals that we talked about, including mental health, substance abuse, discrimination, etc. All of these data have been compiled into an evidence-based consensus that really strongly advocates for the medical necessity of gender-affirming surgical interventions, and that medical necessity is what underlies the care that we provide from an insurance basis, which really goes a long way for supporting the equity of care that's provided to patients that fit into this patient population. But despite this, you can see here only 7% of trans women have undergone facial feminization surgery, despite the fact that more than 50% of them desire it at some point in their life. And this is due in part to the limited coverage of gender-affirming facial surgery by a large majority of companies across the United States. This graph is demonstrating in the green and the yellow out of the top 150 healthcare providers throughout the country who has pre-authorized or case-by-case based approvals for gender-affirming facial surgery. And then, of course, the large red segments of this graph demonstrates those policies that never cover any gender-affirming facial surgical care. So I want to sort of pivot to highlighting the role of gender-affirming care here at Stanford and the incredible work that the Stanford LGBTQ+ program has provided and the growth that they've experienced over the past number of years. These slides, a few of them I borrowed from Blaise Bush down here, who is our executive director of the LGBTQ+ program, run by Leslie Subach, who is our founding director of the program. There is an annual health enterprise meeting that is held. It was just held about a month ago, and anyone's invited who's involved in this type of patient care, where we go over sort of the mission, the vision, and how this program sees itself moving on into the future. There is a large health program executive leadership committee and a number of names up here who are very involved in providing holistic care to the LGBTQ+ community. The name that you'll see right here, Kavita Mishra, is our surgical representation on the executive committee. She is in the Department of Urogynecology, and she does transgender vaginoplasty. And I believe is the longest tenured ongoing surgeon here in the Stanford LGBTQ+ care program. So this is just a brief timeline of selected history of LGBTQ+ care here at Stanford. There is really kind of a tumultuous history when it comes to how the program has developed. We started back in the 1970s. We opened one of the first clinics in the U.S. to provide gender-affirming surgical care. And this was with one individual surgeon who really pioneered a lot of the surgical work here in the Bay Area, but a program never really developed around that. There was some waxing and waning experience with this program until about 2016, so really 8 years ago is when we see the groundwork being laid for this type of care that's being provided here at Stanford. The Thrive program, that's an acronym that you may see or hear about. It's sort of the mental health branch of our gender-affirming care program. It was founded in 2016 and is really integral for providing sort of the basis of support for these patients as they navigate their way through this really complex system of whole body or holistic care. And then just highlighting here, 2024, really this year, with the hire of a phalloplasty surgeon, we have finally been able to claim that we offer full-spectrum gender-affirming surgical care with myself and Dr. Nguyen providing surgical care from the otolaryngology perspective, several providers within the plastic surgery department, urology, urogynecology, OBGYN, etc. And so this is really exciting to see sort of this rapid growth of a system-wide program that really aims to provide care for these individuals. This is a point of pride for the Stanford program here. The PRIDE study is the first large-scale multi-institutional longitudinal national study for individuals who identify as LGBTQ+, and it's housed here at Stanford since 2018. Has really done a lot to help boost our presence on the national scale and from a research perspective. So this is what that program looks like today, and the mission of the Stanford LGBTQ+ program is really to provide comprehensive health services across a lifespan of care. And so this timeline, starting from perinatal care all the way to adulthood and beyond, highlights the fact that this starts with family planning, right? And so we have plenty of patients who are looking to have children, start a family, and we're looking to support them from that process through children being raised by non-traditional or gender-diverse families. This care is really run through the gender clinic within the pediatric endocrinology department at Lucille Packard. There's tons of wonderful things that can be said about the care that's provided through that clinic. It won't be a focus of this talk, but they do great work, and then really that care is transitioned to the primary care clinic, which is housed in Los Altos. And there's an incredible number of providers who focus solely on providing primary care to these LGBTQ plus patients, which really plays an integral role in allowing me to do what I do, because I could certainly not individually provide the amount of care and support that's necessary to shepherd patients through these types of major transitions that accompany things like gender-affirming facial surgery. This just breaks down the gender-affirming services that we provide here at Stanford Healthcare, and you can see that we provide a full spectrum of interventional services that range from hormone therapy to surgical services, and like I said, full body surgical services head to toe. You can see otolaryngology really well represented here, both in facial feminization and masculinization surgery, as well as voice surgery and voice therapy. I stole this slide from Dr. Nguyen, who can really tell this story in a lot more detail, but he's done amazing work, as have the Stanford Laryngology Division, to develop this gender-affirming voice center, which provides full-spectrum vocal care and is really unique in the surgical interventions that they provide, which is one of the very few sites in the entire world that provides these types of vocal feminization and masculinization surgeries. We, Dr. Nguyen and I, collaborate quite closely with a lot of patients, and I rely heavily on him to help with these transitions, both pre and post-operatively, and sometimes together in combination cases, which we've been able to do, which has been a really neat opportunity for me as well. This is the website that I built through Stanford Healthcare. This QR code can get you to that link, and if you ever want to direct patients to this resource, there is a really comprehensive amount of information about what gender-affirming facial plastic surgery involves, what that journey looks like, and what expectations they should have along the way. And this has been really helpful in being able to direct patients to the amount of information that they need to digest, which really can't be given justice in a single or even multiple 30-minute clinic visits. So I wanted to now sort of take some time to highlight what it is that I do. And the residents have seen some of this before, both in our recent FPRS course that we hosted here at Stanford, as well as in some of the resident education courses, as well as in the operating room. And some of you have had the opportunity to get into the OR with me and see some of these cases, which are really very neat, very hands-on, and I think very educational. So if you do get the chance, I'd love to have you join me in the operating room for these types of cases. This is a very abbreviated version of a talk that I gave on the LGBTQ plus health grand rounds. That's a recorded presentation that you can find on the Stanford YouTube site. And that's an hour-long grand rounds talk where I really dive into some of the more finer details of this type of surgery. But I wanted to break down here just some of the basics for some of you, and then bring in a couple of surgical images and videos just to highlight some of the work that we're doing in the operating room. So what is gender-affirming facial surgery? It really encompasses any surgical procedure that aims to modify facial features to be more congruent with one's desired physical expression of gender. And the ultimate goal is to reduce gender dysphoria. And so we'll talk about that. Gender dysphoria is the psychosocial distress that comes with someone's outward appearance not matching the gender that they embody. And we'll talk about how gender differs from sex as well, briefly. You'll hear different synonyms or colloquialisms for this type of surgery. Facial feminization surgery is the most common terminology that you'll hear or read about. And really, we sort of lean in that direction when we're talking about these types of procedures because of the dramatic impact that hormone therapy can have on trans men, meaning that individuals who are assigned female at birth and transition to become a man, when they are exposed to testosterone, they can experience a lot of the changes that we as cisgendered men experience during our puberty at a young age. And oftentimes, these surgical interventions are not as imperatively required to be able to get these individuals to a point where they are feel congruent with the gender that they express and their true gender identity. Just a brief bit of history, but Douglas Osterhout was a surgeon here in the San Francisco Bay Area. He practiced at the University of San Francisco, and he really pioneered a lot of the work that was done back in the 1970s to modernize gender-affirming facial surgery and bring it into the modern era of what it is today. And we'll talk about what that means. I wanted to include this slide because terminology is really often very important to these individuals who are either sex or gender diverse. And the reason that it's important is not so that they can police the words that you use, but it provides them the vocabulary to be able to express what are often really complex and misunderstood concepts. In this case, we're using this illustration to divide out 3 terms: gender identity, gender expression, and anatomical sex, which are all different terms and indicate different aspects of someone's gender identity. Gender identity is a person's innate sense of self, who they are and who they identify as, which may differ from their anatomical sex or whatever sex they were assigned at birth. And then gender expression is really the way in which you choose to portray yourself to the outside world. So we all wake up and make a choice in the morning of how we're going to dress, groom ourselves, potentially put on makeup, and that plays a big role in how society perceives us. Gender expression can be really dramatic. This is a famous YouTuber who goes by the name of Abigail Thorne, and this is from her YouTube video, her coming out YouTube video, where she starts the video in her pre-transition state with a very masculine gender expression, and then comes out in a more feminine gender expression, and talks about what this means to her. And it's a really powerful video. To this effect, we've actually developed, I've worked with this non-profit called Beautiful, which exists here in the Bay Area. And I've been able to put a number of my patients already through this training course that looks to provide gender expression education to a number of patients, really starting from the ground up with skincare and makeup application to allow patients to feel more comfortable. One of the common complaints that I have from a lot of individuals who come into my clinic is that they don't even know where to start because they feel like they're dressing up in drag when they put on makeup, and nobody's been able to teach them how to do that in a comfortable way so that they can express themselves in a way that they feel comfortable. And so this helps lower the barrier of entry into patients feeling comfortable expressing themselves in the way that they would like to. Sex-based differences in facial anatomy are really well documented, and this is a foundation of what we do in facial plastics and reconstructive surgery. There are cephalometric studies that demonstrate that the skull itself is different between cisgendered men and women, and a lot of this is attributed to the effects of testosterone exposure during puberty, right? So the male skull, being more what we call square-shaped or rectangular, has a very long chin, wider and fuller jaw, more prominent brow. These facial features were really broken down in the neoclassical era when Renaissance artists were proportioning out the face for the sake of visual representation in the arts and divided sort of the harmonious face into symmetrical vertical fifths and horizontal thirds in order to be able to analyze the face artistically. And this is really a foundational way that we break down the face in facial analysis even today when we're educating residents and medical students on how to analyze the face in the clinic. This sort of type of analysis has been adopted into gender-affirming facial surgery and really modernized. This is a great study by our colleagues up at UCSF that looked at CT scans and was able to sort of demonstrate the major areas of facial discrepancy between the masculine face and the feminine face to help generate a menu of interventions that would allow for the feminization or the masculinization of the face towards the desired gender that we're looking to generate. When it comes to candidacy for gender-affirming facial surgery, we really made the argument for why we should support gender-affirming facial surgery, but who are we providing this to? There's really no federal definition of medical necessity, but we're not just sort of shooting from the hip with a lot of these procedures. There's incredible evidence-based guidelines for the provision of care, and the World Professional Association for Transgender Health creates these consensus guidelines for standards of care as it pertains to transgender health. We're now on the 8th version. This was just released in late 2023, which really gives detailed guidelines of how we should go about providing this care and what's necessary to obtain successful outcomes beyond just really well-done surgery and very well-trained surgeons. The criteria for candidacy is defined in this WPATH Standards of Care guideline as individuals experiencing persistent gender dysphoria. So here in the state of California, where we have really strong support for insurance coverage of gender-affirming care procedures, a diagnosis of gender dysphoria is all that's required to obtain insurance authorization for these individuals. Now, that doesn't mean that we get carte blanche to get authorized any procedures that we would like to, but oftentimes we can negotiate with these individual insurance-based providers to obtain authorization to provide the care that we need to on an insurance basis. But a lot of extra legwork is required. And so to have a successful practice, this is really why, harkening back to that LGBTQ+ program that's been developed here at Stanford, having those resources to provide the care, to establish the relationships, and provide the perioperative support is necessary for these patients. One of the things that you may hear about are letters of necessity that are required for these individuals. And oftentimes they're required to have an established relationship with a mental health provider who can provide a letter of support within the insurance authorization request to say that, yes, this patient understands the risks that they're taking, understands the expectations for the outcomes that they might have, and that they have a realistic understanding. And so having that sort of network of care is really integral to provide this care that I could not certainly do alone. So just highlighting here some of the procedures that we do in gender-affirming facial surgery. One of the unique things about facial surgery in the gender-affirming realm is that it compromises a number of individual procedures, really all of which we do on an individual basis for many of our cisgendered patients who are looking for cosmetic interventions. But they're being done in combination to meet the needs of these individual patients. So it's really a very shared decision-making process, and it's selective to individual patient needs. This cartoon is just highlighting some of the incisions that a patient might expect in a full facial feminization procedure, and I've been able to work with Chris Scrollop, who's one of the medical illustrationists that our department has worked with closely to develop some really neat instructional illustrations for patients to help them understand sort of what they're getting themselves into. So this split face is useful to demonstrate some of the procedures that are required for facial feminization and facial masculinization. So you'll see on the left side of the screen, we've sort of highlighted some of the facial masculinization procedures that we might do. And on the right side of the screen, the facial feminization procedures that we might do. And I'm really going to focus on the right side of the screen because, like what I talked about, that compromises 90% of what we do in the surgical world. So in my patients who are seeking full facial feminization care, I like to break down the face into thirds because it is really, I think, helpful from a logistical perspective for patients to be able to break down how they analyze their own face, but also from a practical perspective, how we go about doing these procedures in the operating room. So the upper third of the face constitutes the hairline, the brow, and the upper eyelids. So these procedures can involve adjusting the position of the hairline. It can sometimes involve hair transplantation. Frontal cranioplasty is addressing the bony contour of the frontal brow, orbital rim contouring similarly, and then brow lift and blepharoplasty. When we move on to the middle third of the face, we're often talking about the nose and the cheeks, with cheek augmentation, rhinoplasty, and then sometimes otoplasty for patients who experience dysphoria from enlarged or prominent ears. And then the lower third of the face can include things like a lip lift, lip augmentation, mandible reduction or mandibulectomy, genioplasty, which can be done in a variety of different ways, submentoplasty, chondrolaryngoplasty or tracheal shave, Adam's apple reduction, and then in select patients, a face and neck lift. So really what I've gone through here is a full spectrum of the procedures that we provide in facial plastics and reconstructive surgery. And we do these surgeries in a variety of patients for a variety of different indications. And in these patients, they're done with the goal, like we said, of addressing a patient's gender dysphoria. The most dramatic transformations are really made through the bony modifications of the craniofacial skeleton that we make within these procedures. And that's because we can really augment the shape and structure of the face to more accurately represent that craniofacial structure that we talked about that differentiates the masculine and feminine skeleton. And so here we're highlighting some of the changes that are made when we do that frontal cranioplasty procedure or reduction of the frontal bone, a rhinoplasty, cheek augmentation, and then chin and jaw augmentation. And these types of procedures often involve bony osteotomies, manipulation of the craniofacial skeleton, and sometimes can involve plates and screws to position these bony sections of the face into a position that is going to allow for a more masculine or feminine appearance. I just wanted to briefly highlight to show you sort of how some of these procedures are done. The procedure of frontal cranioplasty, sorry, I skipped ahead too quickly on that. In about 80% of patients who have a very well pneumatized frontal sinus, we really can't just contour the frontal bone or we'd be taking away the anterior table of the frontal sinus. So in order to maintain a patent and safe frontal sinus, we actually have to do what's called a frontal sinus setback. So this involves cutting out a bony window of the anterior table of the frontal sinus, contouring that bony window, and then setting it back in place in order to maintain a patent frontal sinus. And so I have some surgical videos here, so if anyone's squeamish about viewing surgical videos, if we have non-surgeons or clinicians on the call, that's what's coming next. And this is demonstrating sort of how we approach that anterior table of the frontal sinus. Here you can see that I've used a trichophytic incision to essentially peel away the skin of the brow and the forehead in order to expose the orbital rim and the frontal bone. The plastic mold that's on here is a prefabricated, virtually surgically planned cutting guide, which has allowed me to be able to outline the cuts that I'm going to make. And this is highlighting where that pneumatized frontal sinus lies underneath the line that I've drawn for the sake of illustration to show how we are going to remove this bone window and then inset it in a recessed fashion into this pneumatized frontal sinus. We can use that cutting guide to show us where we need to contour the orbital rim in order to expand or open the orbital aperture for the sake of feminizing the eyes in the trans female patient. And then here I'm using a piezotome to make those cuts, a piezoelectric ultrasonic device to safely make those cuts through the anterior table of the frontal sinus into the frontal sinus itself to be able to remove this bony window. Here we're removing the bony window, and you can see that we've safely entered the frontal sinus. We've maintained a lot of the mucosal covering of the frontal sinus itself, and we're going to take that window of bone, and we're going to contour it on the back table. We're going to remove some of those inner sinus septations in order to allow us to inset this bone window in a recessed fashion. Here I'm using just two very thin titanium plates in order to secure that anterior table window back into position in a recessed fashion. And this is a little bit of a disorienting video, but it's showing sort of the dramatic effect that recess bony anterior table to the frontal sinus can have on that really strong frontal sinus prominence that can be very dysphoric for a lot of individual patients. This is what some of these results can look like on the table, and this is a patient who's also had a rhinoplasty, a brow lift, but this contouring frontal sinus surgery can have really an immediate dramatic result for these patients. And just briefly to highlight what you saw in that video, virtual surgical planning in gender-affirming surgery is something that provides us an opportunity to really optimize care for our patients. And this is something that is certainly not a standard of care at this point, and has certainly some pros and cons. Many surgeons will argue against the use of virtual surgical planning in gender-affirming surgical care because it does provide additional barriers to care in the form of cost and need for access. But there's a lot of pros that come along with this. It can be useful for planning, also for practice and training. It may decrease operative time. It may increase accuracy, and that's one of the focuses of our studies here at Stanford, is to look at the modeling that we do in virtual surgical planning compared to the modeling that we do when we're taking 3D images of our patients both pre- and post-operatively. And how accurate can we be with these types of procedures? And really, how accurate can we be in counseling our patients on the types of outcomes that they should expect when they're undergoing these surgeries? There certainly may be an increased cost associated with the use of virtual surgical planning, although that may be debatable when we look at time spent in the hospital and interventions needed during a hospital stay. It does come with an increased exposure to radiation. It's an increased amount of time being spent by myself and other surgical providers in planning these cases for patients. And it may provide a false sense of security for more inexperienced surgeons, although the flip side to that is that it may allow more surgeons to feel comfortable entering into this space and providing this very critically needed type of care. We know that this surgery can be done safely. And this is really one of the luminaries in modern gender-affirming facial surgery, Jeffrey Spiegel, who published, I believe it's over 400 results of frontal cranioplasty for facial feminization, done safely, doesn't require preoperative imaging. And so this is, again, there's robust evidence out there to demonstrate that this surgery can be done really with limited resources in the hands of very well-trained surgical surgeons. This is just to highlight what virtual surgical planning can provide us. And this is a planning summary from a particular company that I have no particular affiliation with. But really, virtual surgical planning can provide us with custom cutting guides for complex osteotomies that we need to create in order to accomplish the outcomes that we're looking for. This is a mandibulectomy cutting guide as well as a genioplasty cutting guide, and it can also allow for pre-planned, prefabricated plates and screw planning that can allow for safe placement. And you can see highlighted here the maxillary nerve, which is showing safety of my osteotomy cuts in my mandibulectomy, showing that I'm protecting that nerve to avoid some of the complications that can come along with these types of invasive procedures. This is often what patients look like in the post-operative state. They're really sort of wrapped up like a mummy. And I like this illustration because it can give patients somewhat of an expectation of what they're going to come out of surgery looking and feeling like. And oftentimes these cases are 12 to 14 hours if we're doing a full feminization surgery in the operating room, and they're requiring overnight stays for patients, and weeks, if not months, of recovery. And so counseling these patients is critical for successful outcomes because patient expectations, really I find in all of the surgeries that I do, are very strongly hinged on a patient's understanding of what their post-operative course is going to be like and what they should expect along the way during that course of recovery. I've worked really closely with some of the nursing staff at the Stanford inpatient side, and this is a very busy slide to demonstrate that we've broken down all of the individualized needs of these patients when they come to the floor at the Stanford main hospital. And this is for nursing education so that the nurses who are taking care of these patients overnight can understand what the needs of these patients are and really to be able to provide standardized care so that we know that we're providing the best care for these patients by educated healthcare providers across the spectrum. And this is broken down into what their expectations might be on the day of admission, on the day of discharge, what they need to have with them when they go home, and what education they need to be provided. And we've put a lot into that as well. This is just to highlight a few of the outcomes that we've had from our gender-affirming facial surgical procedures. This is a patient who's had a brow reduction, brow lift, rhinoplasty, and genioplasty. This is another patient who's had an endobrow, upper and lower blepharoplasty, rhinoplasty, genioplasty, and chondrolaryngoplasty. And then this is a revision case of a patient who had a widened hypertrophic trichophytic incision, wearing a hairpiece in the before and not needing to wear that hairpiece after. Also having a revision rhinoplasty, revision genioplasty, and submentoplasty. All really happy patients. This is just highlighting the amount of work that we do in preparation for these procedures. I like to use preoperative three-dimensional morphing. These aren't my videos. These are actually videos that are available online. But just demonstrating some of the changes that we can make with 3D imaging for the sake of patient counseling. It's really important to have open discussions with these patients. And like I said, shared decision-making, as well as a candid communication of the limitations for these types of procedures. And these are, like I said, individualized procedures that are aimed at addressing a patient's individual or specific level of dysphoria. These patients have really a wide breadth of patient knowledge, and there's tons of resources and communities out there where patients are sharing their own experiences on these forums, some of which you might be familiar with, which is really sort of, they're robust communities. And patients are sharing experiences, they're sharing their outcomes, and they're sharing the names of providers with which they've had good experiences. And so this is an area of outreach for patients where building a good name within the community goes a really long way to building up the legitimacy of the care that we're providing here at Stanford. I do collect as many patient-reported outcomes metrics as I can for these patients for the sake of research, because we're really interested in how are we impacting these patients' livelihoods, mental health status, as well as satisfaction and level of dysphoria. So then, pivoting to sort of the final portion of this talk, I wanted to spend a few minutes really on a personalized, individualized message of what we can do here at Stanford for those of us who aren't directly involved in doing what I'm doing here and providing direct surgical care for these patients. Here in the state of California, we're really uniquely positioned to really take a stand as leaders in providing this type of care for all of our patients. We have the largest number of gender diverse individuals in the entire country. And we've done a great job from a local and statewide perspective of creating equality for these patients when it comes to some of the legislative decisions that have been made, as well as the support and care that we provide. But we know that that's not true on a national level. And there's a lot of work that can be done to bring the rest of the country up to sort of the level of care that we're provided. You know, one of the things that these talks always talk about is advocacy for the type of care that we're providing. And I don't know that that's something that's for everyone, right? We have great advocates within our space. And this is a recent publication from Dr. Nguyen in the AAO HNS Bulletin, really creating a strong call to action for our academy as otolaryngologists to take a firm stance in supporting the care that we provide as a specialty for patients across the board. And there are a lot of societies out there, particularly on the medical side of care, that have taken these stances, and a lot of surgical societies have lagged behind. And I think, you know, there are reasons why, and I think we've all seen within the sort of discussion, the social milieu of conversation that's out there, that there's a lot of controversy surrounding this type of care in individuals. But I think that one of the things that we can do as a specialty is really take a charge in advocating for these patients. For the otolaryngologist who's not immediately involved in providing surgical care for these patients, advocacy really starts with acknowledging the community, right? You're going to be seeing these patients in your clinic, whether you know it or not. And one of the keys to success in providing care for these patients is being understanding, is having knowledge about the care that you're providing these patients, whether or not it's directly related to their gender or their gender dysphoria. The Trans Day of Visibility every year on March 31st will be coming up soon. And I think acknowledging these patients and meeting them where they're at is a big first step to what we do in all of the care that we provide. This is a really jarring portion of a survey-based study that's just a few years old that shows that 1 in 3 transgender individuals had to teach their doctors about transgender people in order to get appropriate care in the past year, right? So the bar is set incredibly low. It couldn't be lower. And so having an understanding of these patients and the types of struggles that they're dealing with in the care that you provide is critical. This is huge. And if there's one thing that you could take away from this talk, I think it would be to really think about whether or not involving this type of education for your faculty and staff is right for you, whether or not you provide direct gender-affirming surgical care. So these are 2 great advocates, Anthony Faux and Travis Rees-Nguyen, who are both part of the LGBTQ+ program here at Stanford. They've created a course. It's an hour and a half. We did it for our facial plastic surgery staff and faculty several months ago. It's an incredible training program that really highlights a lot of the barriers to care that these patients are encountering and educates your staff from the people answering the phone to the people checking patients in to MAs who are rooming patients, how to appropriately interact with this patient population in a way that can make them feel comfortable, whether or not they're here to talk to you about their ears, their thyroid gland, or their face, right? And so really providing comfortable care for these patients is, like I said, the key for success in these individuals. I know that to some people this can be something that provides a large amount of discomfort, but pronouns really do matter to these individuals because it's one small area in which they can have sort of control over the way in which they present themselves. And this is really the most common microaggression that we see against this patient population is misuse of pronouns. And it really does matter. If you're interested in showing support for this patient population, this is what my badge looks like. And these are things that you can obtain through the badge office just across the street. You can get pronoun additions to your badge that you see down here on the bottom. You can get rainbow stickers for your badge. I'm not sure if you can get these badge clips, but I have some extra in my office if anyone's interested to show support to these patients. These are small signs that demonstrate that you're an ally and really provide comfort for these patients when they're coming to seek care for you. Stanford as an institution has a program called We Ask Because We Care. It's an initiative aimed at eliminating health disparities, and in 2024 they incorporated sexual orientation and gender identity into this initiative, really aimed at training everyone who comes on board at Stanford to get some amount of training in these sort of complex subjects. And you'll see this in the chart for patients. If you ever see a patient who has a highlighted gender on their chart, they may have names in quotes. That's a little tip that this is a patient who may be a gender diverse patient, who may go by a name other than what their legal name is in their chart. If you click into this, on this designation of gender in the chart, you can actually see a whole lot more detail about their sexual orientation, their gender identity, the pronouns that they use. And then there's something called an organ inventory, which can tell you potentially what surgeries they've undergone, because surgery doesn't necessarily eliminate their risk for example, development of cancer with aging, right? And so we know that these patients still need to be screened for the types of cancers that come along with the organs that they potentially developed throughout their lifetime. For any of us who are doing surgery on gender diverse individuals, these patients suffer from the same medical conditions as gender normative patients, right? So head and neck cancer, sinus disease, chronic ear disease, salivary gland pathology. These are individuals within the Stanford healthcare system that help take care of gender-diverse individuals in the perioperative setting. And so Amit Joseph is the, I don't believe he exists in photographic form on the internet, but he is the Stanford representative for Grace anesthesiologists. And if you email Amit, he will get your patient set up with a trained and sensitive anesthesiologist who can provide gender-appropriate care for gender-diverse patients. Here on the adult side, Travis Rees-Nguyen is his counterpart at LPCH. And then these individuals, Lindsay Starrick is the nurse leader on the inpatient side for those of you who may be admitting patients, who you can work with to make sure that we're providing and acknowledging gender diversity during the inpatient stay of our patients. And then Vikram Bellamkonda is the program director for all of LGBTQ plus perioperative care, and he can also connect you with individuals who may be able to provide this type of individualized care on the inpatient side. This is a recent study out of the University of Michigan that demonstrates that it was a survey-based study of otolaryngology residents and faculty attendings that demonstrates the level of education, understanding, and ability to educate of individual providers and practitioners of otolaryngology. And it's a really sobering study because it shows that most otolaryngology faculty and residents hold a high positive attitude towards this community, but really that few of us have basic clinical preparedness to treat this patient population. And I found it kind of humorous that it actually calls out attending otolaryngologists as having a significantly lower basic knowledge, humorous in a morbid way, that we really need to, I think, increase our level of understanding and education in order to be able to care for these patients appropriately. To that effect, Stanford and the LGBTQ plus program here have developed training modules, and this is not part of the standard training module yet that we're all assigned, but it will likely become that at some point in the future, that is looking at making sure that we are all on the same playing field when it comes to educating our trainees as far as the type of care that we provide to these patients, and how we incorporate sensitivity into that care as well. Just the last few slides here, but this is highlighting some of the Stanford Medical School courses that are involved in supporting care for sexual and gender diverse individuals. 1 out of 5 training programs have no didactic exposure to clinical training in this area. And this is another area where you can get involved, starting with medical students and then moving on to your residents if this is something that you feel passionate about. And then lastly, I just wanted to highlight 2 publications that have come out of our specialty. This is, again, another bulletin post from the American Academy of Otolaryngology Head and Neck Surgery from our education committee that is highlighting what we can do as otolaryngologists to provide gender-affirming care. And really, the single most important thing that we can do is treat people with respect and dignity, right? Here it breaks down tips for integrating gender-affirming care into your own clinical practice, really starting from the ground up of staying informed, fostering that welcoming environment, practicing the use of pronouns, engaging in cultural competencies, and then collaborating, educating, and addressing disparities, right? Everything that we've talked about in this talk here. If you're interested in learning more, this is an excellent publication. AJ Flaherty is one of our colleagues who works up at Virginia Mason in Washington, and they've done a great job of advocacy for care in this field and have worked to publish best practices for care in an otolaryngology setting, independent of whether it comes from a gender-affirming facial surgeon, vocal surgeon, or just an otolaryngologist who has a surgical practice. This is my little guy. He's the reason that I do what I do. And we're expecting our second here in late March, early April. And so I sincerely want to thank you from the division to allow us to do what we do in the department and to give us a voice here in the Department of Otolaryngology. Thanks so much.